I'm a medical doctor. I'm a specialist in public health. I work at the National Institute of Public Health in Slovenia, and I'm head of Department of Prevention and Promotion Programs Management. The main task of our department is development and implementation and follow-up of preventive programs in primary healthcare centers, in local communities, and across the country. I will start with the health system part. The preventive programs are a right of citizens here in Slovenia, which means that health insurance covers all expenses of preventive care. And for example, every adult is invited every 5 years to a comprehensive preventive program aimed at several chronic diseases, cardiovascular, lung diseases, osteoporosis, mental health, and similar. And when there are risks found or risky behavior, then such person is referred to further interventions on lifestyle change. This is for adults. And for children and adolescents, there is long-going preventive program with several activities almost every second year of a child's or adolescent's life. So somebody is taking care of a person, checking the health status and responding to health needs. And again, national preventive programs in reproductive health also leads to one of the best health indicators that Slovenia has, which is very low infant mortality. And this is because of good prevention in time of pregnancy and postpartum, meaning shortly after labor. That's on a health systems part, let's say, reasons why we are doing well. But of course, it's not only that. Your initial question was how to motivate people. So when there are rights from health insurance, that's relatively easy. But lowering the burden of chronic diseases takes also other actions. I would say that Slovenians are physically active, quite highly active, from the kindergarten or from the primary school on. There is quite a lot physical activity around. And I don't know why, but in Slovenia, running and cycling and mountaineering and skiing are popular sports and many practice. Of course, as in other developed countries, there are differences caused by inequalities between lower and higher social classes. That's definitely the case in Slovenia. But what we are trying to do is working locally on a municipal level, bringing different organizations together, addressing health issues. So, for example, I don't know, a few NGOs, well, maybe Ljubljana is not the best example because it's a big city where everything is available, but smaller municipalities around the cities where you have, I don't know, you have school, perhaps a health professional, church, an NGO or someone, and what we are working there is bringing those together and trying to find what are their inequalities in health or broadly socioeconomic inequalities and what people need. And we are, I guess, lucky, as many of European countries are, that we now build all the roads and pavements and water system and sewage system, so that general safety regarding health is there. So we can now invest in softer programs like preventive programs, health promotion in local communities, and so on. Yeah, I already mentioned the three main programs, but there are also cancer screening programs on breast cancer, colorectal cancer, and cervical cancer, which are also population-based organized programs where every person I mean, everybody from the target group is invited, um, personally invited to the program. So these are also one of our champions in preventive programs. There are also other programs which are not health programs but contribute to health, such as school fruit, vegetables and milk scheme. This is European Union initiative, um, making available fruits and vegetables and milk products to school-age children in schools. And what is important for good health in country is organized school nutrition. So every children in primary school and also secondary school can get a warm lunch every day. And this is the whole organization behind. And then there are agricultural policies shortening the supply chains. We call it from the field to the table. So having this food chains as short as possible. So having locally produced food available. So all these programs actually contribute to health in the country. So health in the village is actually a set of indicators. It's not a program itself. It's a kind of a system of traffic lights showing where municipalities are doing well and where not on several health indicators.
Rating system
Yeah, it's. I mean, you get concrete. I mean, specific statistical results, and the challenge is what we do with this set of indicators. And this is one of the tasks of National Institute of Public Health, presenting these indicators, Healthy Village, to every municipality, and then to discuss what might be reasons behind and what can municipality do about it. For example, if there is bad indicators on traffic accidents caused by alcohol drinking, it's something that municipality can address, this issue. So it's about availability of alcohol. It's about driving culture, whether you drive when you drink or not. Are there support services which allows you, if you get drunk, that you don't get into the car driving, but you get some transport? And of course, which is very difficult in Slovenia, as in many other European countries, to decrease availability of alcohol drinks around, which we are definitely not doing well as we could do it. I understand the question, but I haven't been looking at the data. What are those differences? But where Slovenia is doing well is definitely that early detection of chronic diseases through preventive programs, which I guess it's quite important. Also cancer screening programs, but I don't know how things work in Czech Republic. We are partly Mediterranean country, so Mediterranean diet is, I wouldn't say that it's prevailing, but it's strongly present here. As I said, Slovenians are physically active quite quite a lot, but I wouldn't know what would the other reasons be. Because I guess in alcohol drinking we are quite there. Both of the countries, I think, have quite high alcohol drinking rates. And in smoking, I guess we are similar, so I'm guessing actually. There are no changes in programs. So programs are now, after COVID, available as before. But we didn't catch up the numbers from before COVID era. So the number of people entering preventive programs or going to preventive programs are, after COVID, still lower than before. It's one of the reasons is that primary care doctors, general practitioners, family physicians, who during COVID were not able to manage their population well. They, at the moment after COVID ended and until today, they are still struggling with chronic patients being disbalanced in their treatment. So the emphasis or the great efforts now are going towards chronic patients to set their disease back in expected ranges. So the preventive care is still lagging behind, I would say. But the programs are there, so practices are fully open, and I guess we should catch up soon. On the other side, cancer screening programs were already during COVID back on track. So we've had only few months interruption of cancer screening program provision, and after that they already caught up the population, which again wasn't checked at the time. Well, that's a $1 million question. So it definitely, I would say so, the very good example are cancer screening programs, because they actually aim at detect changes which are not visible, but are visible through certain procedures, laboratory procedures. There is really good promotion of such programs. So media, ads, advertising on popular media, lots of activities in municipalities, and this leads to less fear in people. So cancer screening programs have, on the other side, it's a story of cancer. So everybody who hears cancer frightens at the moment. So we were building this trust through years, and cancer screening programs are a success story in Slovenia. On the other side, also for other programs, we have media campaigns to address adults who should come for a preventive checkup. Well, we do not have enormous funds, but we do every year at least some smaller scale campaigns to remember citizens here that there are programs available. But there is, I don't know, there is no magic wand what that I would give you a specific answer. You should do that, and people will feel this motivation to go before it's too late. But there have to be programs and organized efforts of society. That's what works. Of course, I'm a public health expert, so that's the paradigm behind public health, and I strongly believe it, because organized efforts of society are those who make the change. Well, I think it is. All in all, when you put all together the pharma and the big profits and everything, I guess it is. Because I think we wouldn't see such society as European society with good life expectancy, with good, healthy life expectancy, if there would be only interests of industries and I mean other important stakeholders. I mean, but then we can discuss whether this is which interests are healthy citizens or healthy people. Is it because we can then work longer and work harder and struggle more? I don't know. That's a rhetoric question in a way.